let's briefly look at the skin condition in leprosy known as Erythema Nodosum Leprosum. Erythema Nodosum Leprosum is an acute inflammatory complication of leprosy, most commonly seen in patients with multibacillary forms, especially lepromatous leprosy. So this is just a form of skin lesion commonly seen in lepromatous leprosy. So you can see the lesions here, you can see how reddish they are and quite roundish. They appear almost everywhere on the skin. You can see them on the chest, on the face, on the arms, it can be on the legs, at the buttocks. So erythema nodosum leprosy is a type 3 hypersensitivity reaction, which is also known as immune complex mediated reaction. It occurs when antigen-antibody complexes deposit in tissues, triggering widespread inflammation. So when a mycobacterium antigen gets into the body, it stimulates antibodies. So the antigen plus the antibody now forms a complex. This complex now deposits in various tissues of the body. It could be the skin, and what would happen, this will result into inflammation, and the inflammatory process will present as those reddish roundish lesions on the skin. So what are the clinical features? Painful red nodules, typically on face, arms and legs. Nodules may ulcerate, so you can see them becoming ulcers here. It would present with fever and malaise, that's high temperature and body weakness. Neuritis, that's nerve pain, which will result into risks of nerve damage if not treated early. Edema of face and limbs, that's swelling of the face and the limbs. There could also be systemic involvement, such as in the eyes, which will cause iritis and episcleritis. It could be in the testes, resulting to orchitis. It could be in the joints, resulting to arthritis. It could be in the lymph nodes, resulting to lymphadenitis. In a nutshell, this is trying to tell you that when it comes to systemic involvement of erythema nodosum leprosum, there is gross inflammation whatsoever system this immune complex is being deposited in. So if it is in the eye, it will cause inflammation of the iris. If it is the testes, it will cause inflammation of the testes. In the joint, inflammation of the joints. So wherever you see initis or titis, you know it is an inflammation. So if not treated early, these ulcerations could result into what? Something more severe, necrosis, or even worse. So this occurs when leprosy is being treated, but can occur before or during after treatment or therapy. It is common in patients with high bacterial load. So patients who are not treating the infection properly or are not treating it at all. So let's look at the simplified version of the pathophysiology. So mycobacterial antigens plus the antibodies would form an immune complex. So this immune complex will be deposited into several tissues, and this will result into complement activation. Complement activation in these tissues will now result into inflammation of the said tissues. So how do you treat this? The main goal of treatment is to control inflammation and prevent nerve damage. The drug used here is Thalidomide, and it is the most effective drug, and it is contraindicated in pregnant women. You know what Thalidomide does in pregnant women, the loss of limb in children. When pregnant women take it, they give birth to children without limbs most of the time. You can give corticosteroids like prednisolone, that's to reduce the immune activity. You can give Clofazimine, which is an anti-inflammatory drug and is used in chronic cases. Continue multi-drug therapy for leprosy. So, what are the key points to remember? You should remember that Erythema Nodosum Leprosum is painful and systemic. It is due to immune complex. So it is immune complex mediated and it is seen in lepromatous leprosy. Thanks for listening. Do not forget to like, share and subscribe for more videos.